Hello, we're going to be talking about Chapter 57, Applying Theoretical Knowledge and Skills of Pharmacology with Drugs for Men's Health and Reproduction to Male Patients with Chronic, Acute, Critical, and Mental Health Care Needs. So, androgens are male sex hormones. They control the development and maintenance of sexual processes, accessory sexual organs, cellular metabolism, and bone and muscle growth. A man experiencing a decrease in libido and testicular atrophy may require testosterone replacement, such as an androgen. It's well absorbed, IM, usually given 50 to 400 milligrams every 2 to 4 weeks. Its higher doses are used to treat actually metastatic breast cancer. Indications for its use: hypogonadism and delayed puberty in adolescence. What we hope to achieve with this medication or this testosterone replacement is to achieve normal androgen levels, slow the progress of estrogen-dependent breast cancers. Its mode of action: it develops and maintains male sex organs and secondary sex characteristics. Some adverse reactions that we might look for: acne, masculinization, irregular menses, urinary urgencies, gynecomastia, red skin, jaundice, sodium and water retention, allergic reaction, depression, habituation. Some life-threatening things we could see is hepatic necrosis, hepatitis, hepatic tumors, and respiratory distress. Some drug interactions for testosterone replacement: anticoagulants, barbiturates, phenytoin, corticosteroids. Lab interactions: it does decrease blood glucose in diabetics. It does increase cholesterol, thyroid and liver function, and hematocrit. Androgens including androderm, testoderm, TTS. It is a transdermal patch. It's at 5 milligrams. It's changed every 24 hours. Important to know that it is not applied to genital skin or bony areas. Androgel is only one type of androgen replacement drug. There are several others. You have Fortesta, Axiron, Striant. If in use, it's important to teach the man to ensure he receives regular evaluations of serum lipid levels. Striant, some really good teaching with this medication. It's a buccal mucoadhesive testosterone system. It's used to treat androgen deficiency. It is well absorbed because we are going into the cheek. It is important that you let the patient know that when it is in use, that it has to be replaced if it has slid out of position for more than 4 hours. We talked about some adverse effects. Here are some of our side effects of androgens for testosterone replacement. Priapism, gynecomastia, spermatogenesis halted, and oligospermia. Again, our adverse reactions: we could be seeing some hypercalcemia, virilization, teratogenic effects, and a hepatic carcinoma. So some important teaching that we have for our patients. Contraindications: pregnancy, nephrosis or nephrotic phase of nephritis, hypercalcemia, pituitary insufficiency, hepatic dysfunction, BPH, prostate cancer, history of myocardial infarction, and men with breast cancer. We want to use it cautiously for patients with hypertension, hypercholesterolemia, CAD, renal disease, seizure disorder, infants, prepubertal children, and older men. So a little bit about anabolic steroids, or anabolic androgenic steroids. They're a class of steroid hormones related to the hormone testosterone. They do increase protein synthesis within cells, which results in the buildup of cellular tissue, anabolism, especially in the muscles. Anabolic steroids also have androgenic and virilizing properties, including the development and maintenance of masculine characteristics such as the growth of the vocal cords and body hair. These are available in nutritional supplements. Older teens are the heaviest users, but more than 1.5 million junior high school students use them as well. They're marketed as sports supplements or teen formulas. They can also be purchased without a prescription in stores and on the internet. As I said, these testosterone precursors are available as nutritional supplements. They do have health risk from long-term use, increased LDL, decreased HDL, acne, high blood pressure, liver damage, and dangerous changes in the structure of the left ventricle of the heart. Not something we really want to encourage our teens to be using. Some other steroids that are available. These are especially popular with athletes. HCG is one of those that's very popular. THG, that's a hormone used to treat infertility and stimulate testosterone production. It is a very potent androgen developed to escape urine detection. It is not approved by the U.S. Food and Drug Administration, and it is not legally marketed at this time. So let's talk about our nursing process for our androgens. What do we want to assess with our patients? What's some things that we want to look for? Well, first of all, we want to look for and assess the reason for the androgen therapy. We want to make sure that we monitor the patient's weight, their blood pressure, the liver and thyroid function, hemoglobin and hematocrit, creatinine, clotting factors, glucose tolerance, serum lipids, and electrolytes. We want to look at their nursing diagnoses, disturbed body image, delayed growth and development if we're assessing a young teenager, situational low self-esteem, sexual dysfunction, and ineffective sexuality pattern. In planning for this patient, we need a collaborative effort starting with the patient and with their adherence to the regimen. We need them to know what all the adverse and side effects are to the therapy and report these immediately. The goal would be to achieve and maintain a positive self-concept during the long-term treatment. Patient teaching, another very important component of androgen therapy. A man undergoing androgen therapy may not be able to assist in conception if he and his wife decide to begin trying. So it is important for them to know that it may take up to 3 months, even longer, before conception will occur. We also need to be culturally aware of these patients. We need to follow up with evaluations. It's always good to go back and find out, did our teaching work? Is there something that the patient didn't quite get in the teaching? Are they taking their medications the same time every day? Antiandrogens or androgen antagonists block the synthesis or action of androgens. These drugs are used in the treatment of benign prostatic hypertrophy, BPH, advanced prostate cancer, and as a hormonal therapy in the treatment of endometriosis. They also may be used to treat male pattern baldness, acne, virilization syndrome in women, and precocious puberty in boys, although their effectiveness is not exactly well established. Ulexin, for instance, is one that is used to treat metastatic prostate cancer. So other drugs used in some other male reproductive disorders, things that we might look at, developmental disorders such as undescended testes. Those could be associated with infertility and testicular cancer. Delayed puberty is a big one. We're looking to see the cause of it. You might have a child that might not grow as tall as what they thought he would initially be. Uh, it may be just part of the normal process for this child. So they have to do a full workup on the child and to determine if there is a problem with androgen. So treatment is not initiated though before 14 years of age, and it's going to be done only after a full evaluation. Some pituitary, thyroid, and adrenal disorders. Inadequate pituitary function can be another cause of hypogonadism. There's these drugs that they're given LH or FSH therapy. They're both indicated to be given if the levels are low in the man. It does encourage spermatogenesis in males with primary or secondary hypogonadism, and it induces ovulation in ovulatory females. We're at the end of our lecture. I have a couple more slides for you to go over. However, I have a YouTube video on here that you might like to watch if you want about 2 minutes of laughter. We're looking at drugs that are used in other male reproductive disorders. So we're looking at sexual dysfunction, Viagra, Levitra, Cialis. I think we've all seen the commercials for these drugs. We have to be aware of the patient history, though, before beginning these meds. Look for nitrate medications and nitroglycerin in their history. Uh, these can cause, if they are given in conjunction with one another, can cause a sudden and significant drop in blood pressure. If he doesn't report these medications, be sure to look at the medical history. Is there any angina? Is there anything that's going to alert you on there that this patient likely takes medications that could interact with the Viagra or the Levitra or the Cialis? Viagra is one of the out of the three that the man must take 30 minutes to 4 hours prior to sexual activity. Some natural products, herbs used for sexual performance. Again, you want to caution your patient, and we need to look at the drug history of what they are taking before they start any of these therapies. With the exception of the yohimbine, that one has been studied and scientifically. The other compounds do not have any proven benefits because research hasn't been done on them. Their benefits do appear to reflect popular or cultural beliefs, reports in health magazines, and such. Saw palmetto is a popular herbal remedy used to treat symptoms related to BPH, and it can help shrink enlarged prostate glands. Drugs for treatment of BPH, benign prostate hyperplasia. As a man ages, the glandular units in the prostate gland do begin to undergo tissue hyperplasia. It results in prostatic hypertrophy, and so it enlarges. The exact cause of BPH is unknown, but its development is almost universal in older men. The enlarged prostate gland contributes to overall lower urinary tract symptoms, either through direct bladder outlet obstruction or from resistance within the enlarged gland itself. The man has a storage and or voiding disturbances, such as sensation of bladder fullness, frequency, nocturia, hesitation when trying to begin urinating, dribbling of urine, and erectile dysfunction. The Proscar, Avodart, those are both have side effects of decreasing libido and erectile dysfunction. The Proscar finasteride will be taken indefinitely. It does cause the decreased libido and erectile dysfunction. Women of childbearing age must not handle crushed or broken tablets due to possible absorption and potential risk to a male fetus. Flomax. Flomax is also used to treat kidney stones in both male and female. The patient may experience some postural hypotension, dizziness, or fatigue when they are taking these medications. It is an alpha adrenergic blocking agent. They're also used to treat blood pressure, so to avoid a hypotensive episode, advise using at bedtime and reconcile all medications taken before adding another antihypertensive drug such as Flomax. Instruct the patient to take the medication with food. Talk to him about the possible symptoms of postural hypotension and dizziness. Caution them about driving and operating machinery. Thank you for listening to my presentation. You will have a 10-question quiz. The answers to the quiz have been spoken in this PowerPoint, so if you listened, you would hear the answers and know them. Good luck.